Hello all, thank you for joining. I see that we have a few more people trickling in. I'll wait about 1 more minute to just be respectful of people's time, and then we will dive in. If you have any questions in advance, please feel free to put them in the chat box. And we'll definitely have time for questions at the end. Okay, great. In that case, let's dive in. My name is Carolyn Davidson. I'm the Director of State Engagement for Atlas. So I lead our work on the ground, both physically and virtually with our states. I'm joined by my colleagues, Leah, Angad, and Terry. And at the end of the presentation, exactly, Leah and Angad did a brief wave, so you can see them there. And at the end of the presentation, we will also, thank you for asking, Omar. We will check. At the end of the presentation, we will also let you know which states each of us oversees. So if you have any specific questions, we will get to you will know who to contact by state. So going just briefly over the agenda, we'll start with a website traffic update. So you can see sort of how many people are looking at the data that you submit to Atlas. We'll go through current survey response rates and key tips for completing the survey. We'll do a brief discussion on pain points, then talk about the upcoming activities, as well as time for Q&A. And so just as a quick update, so as of the beginning of this week, we've had over 103,000 website sessions nationwide since launch. So as a reminder, we launched in July of last year, so it's been a little under a year at this point. We're very excited to see that. And as you can see here, over 63,000 sessions were in these 6 states in particular. So you can see here the breakdown in the number of sessions and the relative proportion out of the 6 states, as well as the relative state population. So in case you're wondering why Louisiana has 10% of the website visits, they also have 10% of the population out of the 6 states. And thank you to those of you who are chipping in comments in the chat. I'll just note that our data analyst, Justin Chase, is on the line, and he will be looking into this information and either responding during the session or afterwards. To those of you referring to the chat, thank you very much. As you know, the survey is now open. So on May 5th, as well as May 18th, you should have received a link to submit your response to the survey for your facility or facilities. The deadline is July 30th at 11:59 p.m. Central Time. You must complete and attest your responses online. So we won't accept any PDF copies of the responses, either emailed or sent in via snail mail. They have to be online. And as a note, just to clarify, because we've had some questions around this, out-of-date information will be retired from the website this November. So if you submitted the survey last year, but do not submit this year, you will not have quality data on the website because that old data will be retired. And a note on current survey response rates, and these may have increased a little bit, I'll note, as these were updated yesterday. I think we've seen a few come in. We currently have 35 responses in New York, 4 in Massachusetts, 2 in West Virginia, and 1 in Delaware, for a total of 42 responses, which is about 2% of the number of total facilities that are in Atlas. And as a brief reminder, we had about a little over a 50% response rate across our states last year, and we are certainly aiming to exceed that this year. With that, I will turn it over to Leah.
Hello, everyone. Good to see some familiar names. So we have a few tips. I think some of you have seen these already, but just if you haven't gotten to doing the survey yet, this is feedback we've received from other providers on what's made it easier for them. So first, I think it's important to identify one staff member to serve as the Atlas champion. This has typically been a clinical or program director. from what we're hearing, but anybody who's able to just ensure that, especially if you have multiple locations, they're kind of corralling the surveys and getting them done and by the end of July. Second, circulating a reference copy of the treatment facility survey. That's something we did, gosh, I guess it was a few weeks ago at this point, but you're able to print that off. And then if you wanted to go through and pre-fill your responses to the survey, sometimes it's helpful if you have to go to multiple people within your organization. So that's definitely something that providers have been conveying to us is helpful. And then you just go and log in and you can do the online survey, already have the answers on hand. So planning time in the calendar to complete the survey. I know that the time to complete varies depending on whether you're an individual facility or if you have like 8 to 10 facilities within your network. But typically we're seeing this survey takes about 30 minutes to 2 hours. If you do print off the reference copy and kind of pre-fill it, that's where you're usually going to have the 30 minutes instead of the 2 hours. We suspect it's gathering the different pieces of information from front office or clinical staff that's taking the longer amount of time. Scheduling time with leadership. So if you did this last year, you know that at the end of the survey, you do have to have an attestation from a CEO or a similar level leadership team member. So it could be an executive director, someone in a comparable position. But we tried to make that process a little easier this year. There is a summary page now so that they can just kind of review the results submitted instead of having to click through each question, if you remember that process from last year. And then finally, reviewing data before submitting, have the CEO sign off, but also just make sure you double check your information. We do have a period called our provider preview where you're able to go and make sure that your responses conveyed correctly from that survey into the Atlas profiles. But we do want you to make sure as much as possible that you've submitted accurate data on the front end. So next slide. So just wanted to take a few moments, get your feedback, see if there are any pain points you've been experiencing. I know that we've heard from some of you, it sounds like things are going fairly smoothly this year, but if you all wanted to either put in the chat or you can unmute yourselves and just share with us any challenges you've encountered.
Hi, this is Jim. Quick question. Caroline, you said that the survey info from last time, the first round, is going to be purged and providers have to resubmit or else they're not going to be in there. Oh, you're muted.
I just realized that. Yes, exactly. Okay. If they submitted last year, their survey responses, though, the majority will be auto-populated. So when they go into the survey, to fill it out, they'll be able to see most of their responses from last year.
But they have to actually go in and push a button or whatever to move it over or to. Exactly.
And there are a few new questions or that we've updated where they do need to enter a new response. But otherwise it should be easy.
They actually have to go in and do something or else it's not going to show up. And they're like, okay, yeah, that's an important aspect. I think that needs to be communicated then to providers clearly. Okay, thank you.
That's a great question. Great point, Jim. Anyone else have any questions, any challenges you've encountered? Okay. Feel free to go ahead and put them in the chat if you think of something. We also have the help desk available if you have any issues, and you can reach out directly to Caroline or Angit or myself, depending on the state that you're in. So I am covering New York, and then for Massachusetts, West Virginia, and Delaware, you would go to Angit. Okay, next slide. So again, we shared some of this at the last roundtable, but just wanted to share the Atlas website enhancements we're making. This has obviously been an ongoing process the past few years. We are always open to your feedback and to making the site more user-friendly. So you can see here, we're working on ensuring that we have the insurance plans listed correctly. Some of the other pieces of feedback that you've shared with us. You can go to the next slide. I'm most excited about the changes we're making to the password protected portals. I know not everyone's had the opportunity to go into those password protected portals. So if you haven't, please do so. We are making some enhancements to those. So I guess just looking at the screenshot here, you can see some of the enhancements we're making. If you recall, if you did log in before, we had static dashboards that highlighted the Atlas measures across the patient experience survey and the treatment facility survey. You weren't able to do a whole lot with that dashboard, but there was a download available if you wanted to see all of the patient feedback for your facility or look at how you performed on each of the Atlas measures. There's signs of high quality care. But this dashboard has Power BI integrated. It's a lot more interactive. If you look at the top there, you would have your facility selected. You'd be able to look at different factors, whether it's payment, so looking at Medicaid versus private pay. Down at the bottom, how does my facility compare? You can benchmark yourself. So there's over on the right, there's a state overall. And then you would have for each of those different high principles, your facility. So fast access to care, personalized evaluation and treatment planning. There's a section for patient feedback as well. So you can see how you rank compared to others in your state. And I think this is exciting. So actually, if you want to pause here before I turn it over to Angad, and if there's any questions here. This is something you'll see more of too at the June Roundtable. We'll be doing a live demo of that. Okay, quiet group. So before we turn it over to Angad to talk about some of the upcoming events, I just wanted to recap the project timeline. So everyone's aware, obviously, that we're in the midst of collecting the treatment facility survey and the patient experience surveys. We'll be talking a little bit more about the patient experience surveys and how to field those in the next couple of roundtables. August through October is the period during which we consolidate the data, analyze it, and transfer it into the Atlas profiles. And then that's the same time that we'll be hosting that provider preview period. And then finally, in November, we'll have the update rollout to Delaware, Massachusetts, New York, and West Virginia. I know at this point, the data is a bit old, and we had those delays because of the pandemic last year, but we're really excited to get new information in there and to increase the participation that we had from providers last year, so people have more information. And with that, I will turn you over to Angad.
Thank you so much, Leah, and good afternoon, everybody. It's good to see everyone here today. So I wanted to discuss the upcoming Atlas 2021 Provider Roundtable schedule. So in June, we'll have a session on June 16th at 2 p.m. Eastern Time. July, the session there will be July 14th at 2 p.m. Eastern Time as well. And from August to October, as of right now, we don't have any events currently scheduled. Having said that, if we start to receive questions, we will go ahead and schedule a session and make sure that you all are aware of it as well. And in November, as Leah just mentioned on the timeline, be on the lookout for a possible event, as that's when the Atlas site will be updated with all of the new data in our current states who are doing data collection. Also wanted to point out our past Provider Roundtable in April was held on the 20th, and there's a link here to watch those prior recordings as well. So next slide, thank you. So our upcoming continuous quality improvement learning series. So as you'll recall, we started that late last year, and we actually just had our first session for 2021 last week. And just as a reminder, these events are held to sort of help facilities and providers understand how to leverage the Atlas data for quality improvement projects. And so we had a session last week that was sort of a continuation of some of those themes, and all of us already we've received some really good feedback, so looking forward to continuing that. The series this year will include the regular sort of live webinars, but we'll also include some on-demand modules as well. We understand folks' travel schedule over the summer it can be quite busy, but we still want to be able to provide content out to our stakeholders. And again, as a reminder, Audience members are addiction treatment providers, state partner agencies, commercial payers are all invited to join in the discussion. All sessions are recorded and they're always shared after the event. And then there is no cost to attend these sessions either. And our next session will be in just under a month on June 24th at 1 p.m. Eastern time. And Dr. Victor Capocha will be facilitating a panel discussion on quality improvement and what the experience has been from some of our treatment providers as well. And so just a quick reminder, Friday, July 30th, that'll be a date that everyone hears a lot. That is the deadline to submit your survey to Shatterproof. And so just again, a couple of reminders here. By submitting your data on July 30th, you have to ensure that the facility's quality information will be included on treatmentatlas.org. The facility will be automatically included in relevant searches on the Atlas site. You will not be filtered out for lack of data. The information will also help tens of thousands of visitors to the site find the most appropriate treatment for them or their family members. And then also this year we'll have access to free promotional materials for Atlas as well. And then the primary contact for your facility has not received a link for some reason, please contact us at Atlas, the Atlas Help Desk, and there's a link there below as well. So also, we're hoping that everyone can help spread the word. I know we've, as Carolyn mentioned earlier, we've gotten some good start in some of our states in terms of having the survey completed. But if you could encourage your colleagues to fill out the treatment facility survey, it's always a help. We've included here a little blurb at the bottom if you could share on your various social media platforms such as LinkedIn or Twitter. But I think giving recommendations to your colleagues is always helpful. Next slide, please. Thank you. So next steps. So of course, participate in data collection by completing the treatment facility survey. If we were in a room together, I might say on, and then we'd all say Friday, July 30th. But primary contacts should have received an email with a link. Again, if you have not, please do let us know. Make sure you add provider roundtable dates to your calendar. We just mentioned those a few slides ago. But one of the most important parts, of these roundtable events, which we'll have in a few minutes here, is a question and answer session. So we want to make sure that we are available to you all to answer any questions that you might have. Also, sign up for our CQI events and learn how to leverage the Atlas data in the professional portal. You saw from Leah's presentation a few slides ago that we are making some changes there. So look forward to being able to answer any questions that you might have on the portal as well. And then, of course, check out treatmentatlas.org to learn more about Atlas and explore the platform. We talked about leveraging the Atlas help desk as well. And then if you have questions, don't hesitate to reach out to your state engagement director. As Leah mentioned, I'm working with Delaware, Massachusetts, and West Virginia. Carolyn is working with North Carolina, and Leah is working with Louisiana and New York. So again, it's the end of the formal presentation, but would be happy to field any questions that anybody might have.
I can start with the questions in the chat. Thank you, those who have chimed in. I know, Omar, you asked if we have received your survey from GARP at 33 Arch Street in Springfield, Massachusetts. We have indeed received the survey. And just to confirm, you should have received a confirmation page at the end of kind of submitting the survey, as well as a thank you email. Did you see? If not, let us know.
I haven't seen it because my manager, she just sent me the same link, the same day I submitted. So the same day that I completed the service, she just sent me the link thinking that I didn't finish it. So I was back and forth with her. Yes, I did it. So we get a little bit confused. No, that was for last year. No, I did last year too.
We have your survey. You are good to go. And thank you for checking.
Thanks.
Awesome. And Amber, thank you for reaching out about your new facilities. I believe that we have Grit Ridgewood currently in our system, but we will check after and follow up with you. And I think that Amanda, you separately reached out about the survey for MHA, which is great. And Amanda, similarly, we will reach out to you about all the different surveys in your system and who is the primary contact for each, so you can see if any should be changed to a different contact, or for instance, if you would like to receive a separate email when each of those individuals does. I think that's all of the questions so far, but I will pause and go on mute to let anybody chime in, either by unmuting yourself or adding to the chat.
Well, it sounds like maybe we don't have any questions. So certainly if you got the information you needed, feel free to drop off the line. We will circle back with the folks who had questions. And we hope that you have a lovely Memorial Day weekend. Look forward to talking with you next month.